What I like about Schema Therapy is that it really brings together what we know, I think, to be the best aspects of lots of different types of psychotherapies. Schema therapy is an integrative therapy, and that means that it draws from a variety of different models, theoretical models, and a variety of different interventions or therapy tools, so that the therapist can really help you get to where you want to be, or overcome the negative patterns in your life, or get over that chronic or recurrent depression that you experience. So Schema therapy includes interventions that are experiential in nature, that use the client's emotional experience to create change. Some of those include imagery-based exercises, imagery with re-scripting, and Gestalt-like techniques such as dialogue, chair work dialogues, which we know are really very effective and that actually cut to the chase, and that creates more meaningful, longer-term, emotional, deeper level change than, for example, pure cognitive therapy or cognitive behaviour therapy, which really only deals with part of the person. So what I like about Schema therapy is that it helps us understand why we do the things we do. It links together really nicely our past with our current life and our current situation or dilemmas. And in Schema therapy, the therapist is very, very interested in the origins of your experiences, the origins of your difficulties or problems. So we're not just dealing on a symptom level. We're not just about alleviating and applying band-aid remedies. What we're about is looking at how these difficulties occurred, how the depression started, why this certain pattern in your life has been established. So we're really interested in looking at the childhood developmental origins of the problem, right? We're interested in looking at what the core psychological vulnerabilities are. Because unless we do that, we're really only applying multiple levels of band-aids. For example, a client might come along and they may have recurrent, pretty entrenched depression. They may have seen many psychiatrists, psychologists in the past. They may have tried different types of medication, different cocktails of medication, but nothing has actually really affected change for the better, for the long term. They may have had temporary relief, but they may have never really had, long-term relief. I think, and I have seen, that Schema therapy provides that for clients, right? Because we're really interested in looking at the core root of the problem. We're looking at the foundations, why the problems have developed as they have, and what's maintaining the depression, for example. What's triggering the depression? When did it start? What are the underlying core psychological vulnerabilities? An example of a schema is unrelenting standards. This is like a measure of trait perfectionism, right? Perfectionism can be healthy at one level, but if you have too much of it, it can be very destructive. So unrelenting standards is the idea that you're always reaching for very high and unrealistic standards. You're full of anxiety, and you might have another number of coping mechanisms such workaholism, doing 110%, a lot of attention to detail, trying to control everything around you, right? That's like a coping strategy, coping styles. In Schema therapy, we're looking at schemas, which are they're like life scripts, right? Another common example is an abandonment schema, emotional deprivation schema, self-sacrifice schema. And you can read a lot more about those schemas on the website. But they're examples of what we call these early maladaptive schemas that come about from a combination of the temperament you're born with in conjunction with the type of parenting you received and all the other life experiences and social learning and modelling that you had when you were a child. A lot of these schemas, or core life scripts if you like, ways of understanding the world, develop very, very early in life. The abandonment schema, for example, may have its foundations in the pre-verbal stages of life for many people. So most of the schemas develop very, very early in life, first 6 years, first 12 years. And then, because schemas like to prove themselves right, for example, if you have an abandonment schema, deep down you might feel that at the end of the day, no one will be there for me. At the end of the day, important people will leave me through being separated, through death. You might be tied up with death anxiety, separation anxiety. So you may have a deep-seated belief, if you have a strong abandonment schema, that at the end of the day no one will be there for you. You will be alone. You will be left. Your partner may prefer to be with other people, and so forth. Now, whenever this schema gets triggered in you, you will have an urge to respond in different types of ways. In schema therapy, we call these coping styles, and that's really a great addition. That was a fantastic kind of conceptualization that the founder of schema therapy had, Jeffrey Young, to think about these coping styles. When a schema is triggered, we want to behave in certain ways. If you have a strong abandonment schema, for example, and it's triggered because you find out that you weren't invited to out with a few friends, right? You find that out, and you feel really sad about that, really panicky, but your reaction seems to be a little bit more exaggerated than you would think most people might have, right? So it's an exaggerated response. You feel really down, you feel really depressed, and you might have an urge to do, you might feel really hopeless, right? You might have urges to do certain things. One urge might say, you know what, I'm never putting myself out there again, I'm going to become a hermit. If I don't get involved with people, I can't be hurt. And that would be an avoidant coping style. Another coping style might be one where you might find that you get involved with people who are very unstable or insecure, who are never going to meet your emotional needs because you believe, well, I'm always going to be abandoned, so what's the point, right? But you may be involved with people who are not that great for you anyway, who are unstable, who are emotionally unavailable, and you might surrender to that. You might stay in that relationship because you think, this is how it is, this is how it's written for me, I will be left, it's happening again. But that's really because of the partner you've actually chosen in the first place, not because of anything inherent about you as an individual. It's not written in the stars or the sky anywhere that you will be abandoned. That's your abandonment schema speaking. Another example might be you might want to overreact in a sense of counterattack, or what's called overcompensation. So you might find out that you're not invited, or your partner may not be responding to your texts, and you might get very angry. You might become very, very demanding. It's almost like in your head you're saying, I will not be abandoned. Damned if I'm going to be abandoned, I'm not going to make that happen. So you become very insistent, perhaps very pushy, perhaps very over-controlling yourself, perhaps very questioning, not very trusting. You might send 50 text messages to your partner who's away and hasn't responded to you. Where the hell are you? What are you doing? I know you're off with someone else, right? Because you're trying to convince yourself that that fear that you have is not something that's real, right? You won't leave me, that's what you're trying to communicate. That would be an example of overcompensating. So as you can see, all those three types of coping styles are not particularly productive. They're not really helping you heal at all. In schema therapy, the main aim is to try to access those parts of the self that are hurting, that are vulnerable. For example, the origin of your abandonment schema, where that happened, how that developed in life. And somewhere inside of you is that abandoned child, that hurt, wounded and vulnerable child. That might be the vulnerable child mode, and I'll talk more about that in other segments. So that's one of the overarching aims of schema therapy. It's to heal our vulnerability. So schema therapy has all those kind of components. It uses a varied amount of interventions, emotion-focused interventions, relational interventions, working with the therapists to look at how you can better get these core emotional needs met. And schema therapy is premised on the idea that these schemas develop when our core emotional needs as children are not met. So we're all born into the world with core needs. The need to be safe, protected, loved, the need to be autonomous, and so forth. So there's a variety of different core innate needs. And when over time these needs are not met or they're violated, over time, usually on a regular basis, we develop these types of schemas. And that's a sort of a broad way of saying it. But basically, one wants to look at the problems in their lives, what schemas are connected to those problems, and then look back at where they started. What's the core vulnerabilities? When did that schema particularly develop and how it developed? And then how has the client developed these coping mechanisms to deal with the schema, which are all usually not very effective and which serve to perpetuate and strengthen that schema over time. Another really interesting part of schema therapy is this idea of schema modes. And schema modes are basically parts of self. They're like personas, state-like changes that we might flip in and out of. In schema therapy, we want to harness and foster and develop our healthy adult mode, which is our compassionate side of self, the part that knows what we should do to act in our best interests and to take care of ourselves and knows how to get our needs met, right? And how to be our own best parent. So in schema therapy, the therapist is helping you through their relationship with you model what it's like to have that healthy adult mode inside. We all have it to some degree, but some people find it more challenging to stay in that mode, and we don't always stay in that mode. We're all triggered and we can flip into different types of modes. But modes are kind of like a conglomerate of our schemas and the way we cope with our schemas. So an example might be someone who feels really defective on the inside, the defectiveness schema. They might feel really inadequate, but they find that whenever they're in touch with these feelings or when they're triggered, they overcompensate and flip into an overcompensatory mode called the self-aggrandizer. The self-aggrandizer is easy to spot because it's the type of persona where people are trying to big note themselves, one-upmanship. They're like grandstanding, bragging about how good they are. Or they might try to make you feel inferior by being patronising or derogatory. Or they might try to act in a superior way, right? So we all know, we've all seen that. So that might be the mode of the self-aggrandizer, an overcompensatory mode for deeper feelings of inadequacy and defectiveness. So there are many different types of modes. More information again on the website for you to have a read over. And that's another fascinating aspect of schema therapy. So schema therapy helps us identify what were our unmet childhood needs. What didn't we get? Or what did we get that was negative? How did this shape our personality? How did this shape our perception of ourselves and how we see ourselves in the world, how we act in the world? Even the partners we choose, the romantic partners. So schemas are linked to absolutely everything. That's why I love the therapy so much, because you don't have to be, even though it was developed for people with difficult personality presentations and feelings, like borderline personality, for example, which is really just another label for kind of a complex trauma and sort of disordered attachment patterns in childhood. So even though it was developed for these kind of more complex problems, schema therapy can suit and help just about anyone, really, because we all have difficulties that are probably linked to a schema. So schema therapy takes the long-term view. It doesn't tend to be a really short intervention, although you could get insight quite quickly. It usually takes a little while to break unhealthy patterns and a little while to learn how to be in the world in a different way and to have insight into your schemas, when they're triggered, what that means, how you respond. More and a little bit of time to really address those things in therapy. So it's usually a medium to long-term intervention. But that certainly shouldn't stop you. So when I say medium to long-term, I'm talking about, 6 months of some type of regular sessions with a therapist might really show up some really positive and long-term change, because that's what we're looking at, particularly with someone who might have recurrent depression, recurrent relationship problems, recurrent problems at work, feeling like they're people that can't say no, or they've got really deep-seated perfectionism. Anything that is a pattern that is long-term, schema therapy is, I think, the ideal therapy for that type of situation. It's also a really positive therapy in the sense that it's very hopeful. We're not just navel-gazing in schema therapy, we're looking at what we can really do to change and to help you live a much more peaceful version of your life. So give it a try. That's a little bit about schema therapy.